Hey, kia ora koutou whānau. Welcome back to another edition of Big Hairy News. Kia ora, Chewy.
Kia ora, Pat. How's things with you?
Oh, things are all right. How about you, love? What's going on?
Yeah, not too bad. Another Monday.
Big weekend? Busy weekend?
Not at all.
A boneless weekend.
Boneless weekend. Yeah, I did manage that. I achieved nothing and went nowhere. And no, it was good.
I drove up to Christchurch on Saturday morning, hung out with some whānau up there, and then drove back down to Dunedin on Sunday afternoon. It was choice. Here, I'll show you some stuff, eh? So up in Christchurch. This is Saturday night in Christchurch. She was looking fine. Got a really nice boulevard in the center. I haven't been to Christchurch for probably 5 years, and the last time I went to Christchurch, my memory to come away from it was still broken. Like the picture in my head when I went last time was road cones and high vis jackets. But man, you should have a look. She's starting to come along, looking pretty fine. Christchurch over the weekend. The old theatre looking good there. You know. So we had a big old tour. Some friends took us around to motor drive places and look at things. And we went for a walk down the pier, and that's one of the things that was eaten. You see that one? Do you want to know what that is? That is about a 2-inch, maybe 3-inch thick, not a cinnamon roll, but like a cinnamon bun. Heated up. On top of it, 3 kinds of ice cream, and as you can see, nuts and that kind of stuff, and cream. And I didn't eat that. That was mine. That was Leon's, and he finished. Actually, we had a mouthful, but he finished the whole thing because he is an impressive human being. So yeah, had fun. Nice fun. Had my first sort of exasperating time with the vehicle. Went to Shell to try and get the car charged on the way up. Spent half an hour trying to get the charger working, and I just went, ugh. If I already wasn't on board, this thing might this experience might blow my brains out a bit. But you know, we got it working. Learned some lessons. Did like 1.5% a minute on those fast chargers, so I didn't have to sit around too long once it got working. And then on the way back, went to the same charger and just did straight away. We're there for 20 minutes. Got like 38% in 20 minutes. It was great.
Yeah, Christchurch is an interesting one for me. Because I grew up down this way and spent a lot of time in Christchurch. There's big chunks of it that I don't recognize anymore. The whole centre city got carved out. So like my points of reference are gone.
Yeah.
And I've found it quite hard navigating around the centre city just because I don't have those references anymore.
Gotcha.
But yeah, you're right. It's come back. There's some amazing things happening in that town.
Yeah.
And I forget the name of the street that you showed, but that street was always amazing.
Yeah. It's like Cuba Mall, but better. That's how it felt to me, at least. Anyway, just everywhere, whiskey bars and dessert shops and waffle bars and restaurants, and it was really cool.
That was when the earthquake happened, and we saw it was such devastation up there. That was my thought was of that street, and I was like, oh, all of those old buildings, there's no way that they would have stood up to it. It's right by the river. So yeah, it's that street just really dodged a bullet.
Yeah. Yep. Anyway, we went up the hills. We stayed up the hills. I mean, it was a really interesting idea because I've never done this in Dunedin. When you take people on the tiki tour, you always do it during the day. But our mates took us for a tiki tour at night, and it's actually a really interesting perspective going up the hills and looking back over Christchurch with all the lights and stuff on. It was pretty fly. So yeah, I had a good old time. Big show tonight, guys. It's a really big show. Nicola Willis coming up shortly, talking about pre-budget stuff, questions around are there going to be future job cuts, etc. Also, Erica Stanford off Q&A. Really interesting conversation. There's a big part of the conversation that's quite important that we're not actually even going to talk about because it's just going to not be enough time. And that is this idea, and it's not necessarily a National Party initiative because it was trialled under Labor, but this idea that you can get in-school training to become a teacher. So rather than going to university and coming into the school for an afternoon a week, the other way around, in school 4 days a week, training to be a teacher, and then do block courses at universities and that kind of thing. And I thought that's an interesting idea, right? However, my two, and I'll shoot my load now because we're not going to talk about this with her. It's like that's an interesting idea for two reasons. One, you should want to have kind of quality control over your teachers. And that is what like a university course will done. They teach people the same way, and they use the best knowledge or the latest information as to how to train teachers. And my second thought was, if schools are allowed to now train teachers, what about charter schools? And what about somewhere like Destiny having a charter school and then training their own teachers? And that concerns me a bit.
Yeah. No, you've absolutely immediately identified the problem there.
So anyway, you guys can talk about that in the chat. We're actually not really covering that off on tonight, because what we are going to talk about is, funnily enough, COVID with Erica Stanford and the kind of lackadaisical way she just kind of went, well, sick children, but also charter schools a little bit from the conversation they had, because I will I'll keep my powder dry till the end, but there's some concerns. We're also going to have I see that we'll talk about Nicola Willis announcements and stuff today, pre-budget. Just so you know, Craig Rennie is booked in for 9 p.m. Thursday night. So we have economist Craig Rennie talking to us on budget day. I've approached all the political leaders to say, love to have you on budget day, but also would be happy to take you on the days leading up to it. Although it's a little bit going to be a bit of a, what's going to happen conversation, which is not as accurate, but I've contacted all the political leaders. So we'll see how that goes through the week. Right. Starting the show tonight, we are going to talk about a story that we've all talked about many, many, many times before, and it's COVID. This is from the ODT today. COVID at the highest level in 18 months. Hospitalizations are rising. New Zealand has experienced its highest peak in COVID-19 cases since December 2022. Last week, the ministry reported, now reported probably is very different from how many there were. We all know people aren't necessarily reporting as much these days, but reported over 6,000 new cases of the virus and 19 deaths. That was a substantial increase on the number of cases reported the previous week, which was 3,900. The data came from wastewater testing. This is what Professor Baker said, but hospitalizations were also up. We're up to about 35 a day going to hospital with this infection. So because it's a COVID conversation, because, a couple of morons here don't really have all the information, we thought we'll get the expert on. So we haven't talked to Anna Brooks for a while, but let's welcome back to the show from the University of Auckland, Dr. Anna Brooks. Anna, thank you so much for coming back and saying good day to us.
Thanks for having me.
Not to necessarily go, let's push replay on all those conversations we've had in the past. It does feel a bit like, what do we need to know, if anything? Is there anything new we need to know about this latest COVID-19 increase and the projections that we've got this wave coming?
Well, yeah, it is a little bit of rinse and repeat of messaging, but the key message being that it's still here, right?
Yeah.
So, and I mean, the greatest numbers since, what was it, December 2022?
Yeah.
So so it's distinctive, right? So yeah, as the news item said, that it's an extrapolation or an estimation based on wastewater. So, that's all we've got now, because we're not testing. Yeah. So it's that whole, we're in that phase now where COVID is still here, it's still causing deaths, it is still causing disease, it is still causing problems, so on and so forth. And we can't wish it to go away. We can't just ignore it to make it go away. And sadly, globally, that is what's seeming to happen, because the more we don't talk about it, the more people don't think it's there. So yes, it is significant. And the other sort of significant part of what's going on now is when we track New Zealand's pattern, I think is sort of the significant thing here. So, you can have a look at, the trace from since records began. And, we had that phenomenal Omicron peak, and we've never had something so substantial since. So thank goodness, right? Because that's when really the first wave came through. And yes, we've had waves since, but we've not had a sort of a giant spike. So I guess this is the headline sort of saying, okay, we're heading towards something a bit more substantial. And the other part of this sort of picture to sort of put into perspective is that normally we get, when there's a new variant that emerges, it's usually in our summer, which did happen, like as in the JN.1 came over our summer. So when the other hemisphere has their winter, they're usually, battling them all. They're battling a new wave of a new variant and all the winter illnesses. So they get the significant wave. Yes, the new variant hits our country, but we it's not a huge peak, right? So that pattern has happened the last 2 summers. The different thing that's happening now is we didn't sort of peak and go, oh, look, nailed that. We're sitting pretty, and off we head towards winter. COVID's been bubbling along, and now we're sort of pre-winter and getting a spike. So what I've always said when I speak about the interesting trajectory of New Zealand is the one thing I've always maintained. I'm never crystal balling, right? I always say, I don't know what's coming next. In the same way, I reflect and say, look at our traces. We seem to be doing not so badly, like in case numbers. So what I'm now seeing and then so-called sort of saying, well, it's changing, is that we are seeing these cases increase. And so what I've always maintained is we don't know how we'll fare in the winter. And that's starting to play out. So if we're starting to head up now, we so too could start to get the other winter bugs kicking in earlier. And so what it could mean, and I'm always saying could because I don't have a crystal ball, but it could mean that everything hits harder because we've got COVID peaking or starting to traject up now. And is that going to keep going? Are we going to get hit with more variants and so on? So it is a different picture than some of the patterns we've seen before, and especially if we haven't had it this high since over a year ago. So it's all about the same messaging and none of this sort of pretending it's gone, or why are we still talking about that? Didn't that go? Isn't that finished? It's like, no, this virus is going to continue to cause havoc, and it'll cause more havoc the more we try and ignore it. So coupled in with all of that is the fact that we need to maintain public health messaging. We need to not be afraid of hearing that COVID's out there and protecting ourselves and all the rest of it, because layered upon that is, those that might be listening might say, or might not have thought about it, are like, oh, it's heading to winter. Gosh, COVID's everywhere. Might go get my vaccine. So the other part of all this is that if everyone forgets about COVID, and you might get sick and you're like, this is probably COVID, or you're ignoring it, and you might not bother to take a test. So you don't even know when you last had COVID, because the recommendations even with vaccination is to wait 6 months since your infection. So it's kind of like we all now have our own responsibility to to not pretend this virus is gone, and that includes testing, because we luckily still have access to these tools. Overseas, you're hard pushed to find them and you pay for them, right? So those are the sorts of messages that I just wish was still going, right? Like, as in, this is still out there. It is still killing people, and we will continue to see long-term health harms. And that's the thing. It's not like we've peaked and it'll only just bumble along. No. The other message I keep saying about New Zealand is, are we just a few waves behind what we have seen overseas? And again, no crystal ball here. If it's just about how many waves hit our country, it could just be a matter of time. And we know what could happen, and we're blatantly ignoring it. There's my rant.
Nice, good rant. You can wear the Chewy rant of the week. You can win that award so far. I'm interested because you just talked about the measures overseas. They're paying for them, etc. This government has given us the free, boosters and stuff. Or sorry, rats and stuff till June the 30th. Is there, if you are able to answer this question, you may not be able to because of your position, but is there any talk amongst your peers, and I guess I'm talking about those in the realms of science who are doing stuff in and around COVID, of concern as to how this government's going to handle it versus how it was handled?
Well, of course, like, as in, the more it's not spoken about, the more concerned we get. And not speaking about it indicates you're not going to do anything about it, right? Like, as in, we need to hear what's happening. And to me, it won't be surprising if, yes, all of these things that we follow the rest of the world and cut funding and all the rest of it. It's alarming, but it is alarming. And to say that we're prepared for pandemics and all the rest, we're not. We're in a situation where it feels like we are not putting into place what we should be putting into place. But as I say, a lot of this is a global problem. It's not that it's just us. It's just the crazy thing is out there on the other side of the world, everyone still thinks New Zealand's wonderfully doing well, and I'm like, excuse me. So internationally we're riding that wave, and it's kind of frustrating to hear, especially on behalf of those suffering so badly here. You know what I mean? Like, as in when we know how much suffering this current pandemic that we call over, people are suffering, people are not getting support. There's no government support. There are no clinical pathways. There's zero ticks across all of the things that should be being done. And globally, people don't realize that this is the situation we're in. So, and it's not going to go away. And that's layered upon, the health system strains as it is, like we always, it's really frustrating being, the speaker outers, if you like, because it sounds like we're just sort of, spend more money. Generally speaking, preventative measures are far better, money well spent, than trying to treat a disease that is chronic or has no cure for, and all the rest of it. All of those things that compound when we do nothing cost far more money in the long run, right? So it's preventative measures are always better for our economy and all the rest of it. So that's the thing. Yes, some people I'm sure get sick of these messages, but we're trying to prevent the long-term harms because the data doesn't lie. And just because we're not tracking it doesn't mean it's not getting tracked in other countries, and the absolute dire outcomes of, people plummeting or dropping out of the workforce. And yes, teachers and healthcare workers are top of the list. Have not been able to return to work, as we know, as it's hit our headlines in schools. That was no surprise to me, and it's going to continue because the messaging around schooling and that this complete blind spot, that the lack of attendance in school, if you don't say the word illness, what? Like, if you're not considering illness as a reason for, attendance problems, then what rock are you living under is kind of the scenario here, because look at all the international data.
Let's just have a look at this. Sorry, Chair, I was going to throw to you now, but because you've just mentioned it, Anna, this was Q&A in the weekend. This clip's only like 40 seconds, but because you're speaking to teachers, so Jack Tame points out that, as you've just said, teachers are at the top of the list for catching COVID, also long COVID. And just all of us listen to Erica Stanford's response to that. Remember, occupation safety and health means that government says you have a standard of care, a due diligence to keep your workers healthy. Like if a factory floor was causing people to be sick because of something like asbestos, that would be off the charts, legal issues and complications here. This is what Erica Stanford said in the weekend when Jack Tame asked her about why are teachers at the top of this list.
A 2022 Ministry of Health data found teachers have the highest self-reported case of COVID infection of any profession. Otago University researchers found teachers are the most susceptible when it comes to professions for long COVID. Why do you think that is?
Well, because they're surrounded by sick kids, I guess. I mean, that's the key, right? And so
that's all I need to show you. Just like, why do they get COVID? Well, because they were surrounded by sick kids. Later in that interview, which we'll look at later on, Shui, Jack Tame challenges her. So you're I'm using my words now, your big swinging dick where you're going, oh, we're going to get more kids back at school. How is that going to conflict with these teachers getting sick based on COVID? So Anna, happy for you to speak to that.
Oh, it's just, as I say, a blind spot. Force sick kids to go to school so that there's more illness at school, so there's more sick teachers for bums on seats. It doesn't work like that. Sick kids staying home keeps more kids in school. Like where's the lack of logic here, right? Yeah. And if you stop and ask the question about, what is causing low attendance and all the rest of it, or all of the issues that are impacting the education system, and you're not asking about illness, you're not doing your job, right? Like, as in, you're not asking all the questions. You're missing data. You're missing data. So it's a bizarre scenario that, and I say this also off the back of what's happening elsewhere, like in other countries, right? Because it's the same message. It's the same message. There's some outrageous messaging happening in the UK. Can't remember where it was, but it was almost like a comedy skit. It was that bad. Like, as in, is this actual reality, what's been educated publicly? And it was about saying, of course, your kid can go to school. Look, they've only got a sniffle. And it was just like, how are we here when there are measures that can be done? The constant messaging about ventilation and all of those things. Because let's not just forget, like, yes, okay, there's acute illness, sniffing, coughing, and feeling horrible, and all of that, which then spreads in the classroom. But even let's say you've recovered and you're back, and you're not really recovered, right? Because it's COVID and you may have a lingering time to recover. And I'm not talking about the actual chronic illness. I'm just talking about recovering in a sort of a normal sense. Yeah. You might have a delayed recovery where you can't even function at school because you have the impacts on your, the brain foggy. So, basically just a long tail of recovery. And then layered on top of that, of course, the long COVID problems as well. And the reason why school teachers are so high risk is because we know that the more times you're exposed, the more chance is that you will get long-term impacts. And it's not sort of a complete sort of upward climb, right? Count how many infections. It's just that we never know. Like, as in any single one time when you're exposed, today might be the day that you're at peak risk, because we can't track and we don't know why today you're at risk, right? And so what we do know, the way to limit, any particular time that you're most at risk is limiting infections. So yes, we hear constantly of infection 7, infection 8, all of this happening in the UK, and it's not doing anyone any good, with constant re-exposures like that. And those that are chronically sick too, like, what about, vulnerable children? Do we have a head count on how many children in our education system are considered vulnerable? And therefore, has anyone asked if that's why there's a reason why attendance may be down for some families? It's not just the child, but what about the family unit? If that infection could impact the family unit, that could be a reason to, not have your children at school as well. There are loads of reasons, and everyone is just kind of polarizing or blind spotting the fact that this virus doesn't exist, as if it's just any old infection and we should just move on. And sadly, that is not the case. So all of these things are never part of the conversation, all the data, all the questions when we're asking about, situations of education systems, whether it's the children, the teachers, and so on. So it requires policy. And as you just described, workplaces, are required to not expose us to risk. So, if we know there's a risk, it's a high risk job, Yeah.
But they should start getting paid danger money like some jobs do. Chewy, what you got, sir?
So I love Erica's comment, and it just goes to a point that I've made a couple of times over the last couple of months. This government's actually really good at identifying problems. It sees them, and then it just goes fucking bananas on what to do about it. And I think the other thing that we're going to fall into here is, Ardern's government, when COVID came along, they took advice from experts and they formed their policy on that. And we have seen this government's reaction to hearing from experts and its dismissal or outright ignoring them to come up with what they want to do. And I think when we look at the initial outbreak and pandemic and that sort of thing, it was the absolute gold standard of communicating to as many people as possible what needed to happen, where we stood. And I'm not suggesting a return to the 1 p.m. briefings or anything like that. But, people in the chat, did you hear that there was a big uptick in COVID? If so, where? Are you finding out now from us? That is a big change of gears. And I think really just illustrates a point when people say, hey, look, it doesn't matter who's the government, they're all the same. They aren't. And they aren't when it counts.
Yeah. And it just shouldn't be something that's taboo. Like, we just have to now expect that there's illness around. It's not a taboo subject. You know, like we talk about when car accidents suddenly go through the roof, or, you know, we have a weather event, or the sun is burning more, you know, all of those health measures to do with weather, sun, seatbelts, all those sorts of things. They're just part of messaging. And so, like, what is wrong with having respiratory awareness? Respiratory illness awareness is part of messaging. And you know, the thing that's really frustrating for, you know, the vulnerable people of our society is they're just locked out of society now, like, completely. Like, there is no part of society they're safe, like, nowhere. They can't even go to a hospital because they're like, wow, these healthcare workers don't even wear masks. There's respiratory infections everywhere. And, like, don't even get me started on that pathway. Like, some of the, well, like, if you're on a, you know, a high vulnerable ward, you know, everyone's got a condition where the virus can kill you. How is it not mandatory to not, you know, to wear a mask under that setting? So we are here, sadly. We are back to, you know, ground zero and trying to pretend this virus is not here. And it's hard. It's sort of hard push to find anywhere actually doing the right thing, I think, is part of the problem. Because you ask the average person, you know, if they know what's going on with COVID. You know, like, you only really know what's going on if there is a headline and you happen to hear it, or you're a prolific newsreader, right? Other than that,
what even me is I just happened to be, and I don't often check ODT.
Yeah.
I was looking for stories today, and I just happened to check it today, and I just happened to see it. To be frank with you, if I hadn't seen that headline on ODT, I know, and I'm a news junkie, I don't think I would have heard about it.
No, and that's the thing, because it's very low tier now, because it's that thing that we don't want to talk about. Absolutely.
Fatigue about talking about COVID.
Pardon?
Oh, it's just the fatigue. You know, people have put up with it for years, and they don't want to hear about it anymore.
Yeah, but it's also such a political hot ball. Yeah. You know, that the last guys, the guys who we got in now, in part got in pointing to Labor and saying, look how they handled COVID at the end. Labor bad, mandates, lock people up, people lost jobs. So, like, who's expecting this lot to go, okay, let's say it goes up by another 30%. You know, do we really expect these guys to then go, okay, we need to take some public health measures, you know, something like that to help people? And there's people in the chat right now going, COVID's on the rise, who cares? It's like, yeah, but as you said, the vulnerable get locked out, the elderly still die, and people get long COVID. My last question to you, Anna, was going to actually be that you sort of have been New Zealand's preeminent expert into researching and looking into long COVID. Now that we are a long way down the road from 2020, well, you know, 4 years down the road from 2020, what do we now know that perhaps we didn't know in the early stages of you doing your research around long COVID, if anything?
We know heaps. We know enough to be raising the alarm that it is not a flu. It is, this virus is causing havoc, and it's causing havoc like at a high percent than a teeny tiny number. You know what I mean? Because it's spreading everywhere. So, you know, the more we learn, like, put it this way: every time research comes out, it's not reassuring research, right? It's not like, oh, great, it's not as bad as we thought. No, it is. We're learning more and more and more about why the public deserve to know that people are vulnerable. The big sort of black boxes, or, you know, there's tons, she says, we don't know. But the things that we, you know, really don't know is why one of us is at risk and someone else isn't.
Yeah. And,
you know, is your risk factor to do with how many exposures, or is it to do with your immune system? Is it to do with the day of the week? Like, you know, like, there's so many variables as the risks. And because of that, because we can't tell you whether you're at risk or not, whether you've had it no times or you've had it 5 times, we can't tell you you're not at risk from a long-term health consequence. Like, that is the absolute, like, solid part of what we do know, is that we can't tell you if you're at risk or not. Because yes, we know that you know, repeated infections can lead to long-term harms. We know that one infection can cause harm. We know that an infection that barely touched the side, you didn't even notice, you could drop dead from a complication you didn't know you had. So all of those things are very real. And so all we can do with that information is educate. It is not scaremongering, because, you know, what are we going to do in 5 years' time when people say, why weren't we warned? It's like, no, we've been warning. And we're not in any way sort of talking about, you know, grand measures of pandemic scale lockdowny stuff. It's like, if we could make, you know, and put measures in place to mitigate, you know, this constant risk, that's, you know, a first place to start. Like, let's admit that this virus is causing problems, right? So, and yeah, from a biological, you know, there's tons of research that we now know, and yes, it impacts children. Like, that was another big fuss. You know, first of all, we got, oh, kids don't spread it. Yeah, that was a good one. Oh, schools are safe, they don't spread it there. Sure, another, you know, all the layers of information that were just completely untrue. And we now know that, you know, schools are the biggest spreaders, because of course you all congregate at school and then you spread to all of those families when you go home, right? And it's not rocket science, because there's not many families that haven't had this happen. So this is where we're coming from. For example, if schools were the safest place, you'd probably eliminate some of these waves, right? If schools were safe, because that's that common ground where, you know, if you've got 30 little humans, that's 30 homes or whatever, you know what I mean? Like, that alone, mitigating, you're not only protecting our young humans' lives, because we don't know the long-term impacts. You know, that, I mean, that should be top of the list, really. The priority should be protecting our youngest generations, because we know it impacts the brain, we know it impacts the vascular, you know, I could go on. But essentially, you know, it's kind of like, we need to put some effort in here. We need to protect our vulnerable. And as I say, if it was the schools that we made safe with ventilation and, you know, lowering infection risk, it would have a massive impact community-wide, because of that being such a high-risk scenario already, you know. So yeah, it's just, yes, we will always get the COVIDs here, who cares? That, of course. But, you know, people who are locked at home because they can't go out because they're vulnerable, it's not reassuring to them, is it? Because we're just basically becoming an ableist globe.
I have this strange juxtaposition in me, Anna, because we love talking to you, but we hate why you're here. It's like, wouldn't it be so much better if we didn't need to talk to Anna? But when we do, we love talking to you. So thanks so much for joining us again tonight. It's been a while.
You never know, you know, in due course, it could be, you know, take this magic bullet to, you know, get rid of all illnesses. Who knows?
Yeah. I mean, in saying that, we'll have you back anytime for any reason, and we'll continue to do so. So thanks for joining us again tonight.
Awesome.
And hopefully some people out there have heard some words, and maybe it's given them a wake up as well. Yeah.
And you know, and thanks for bringing attention to it. You know, it's not going away, sadly.
All right, Anna. We'll talk to you soon, eh?
Awesome.
Cheers, Anna.
That's right. From the University of Auckland, that's Dr. Anna Brooks. All right. Should we get to some? I notice there's a whole bunch of messages that have been starred. Do you want to get to a few of them while I set the next thing up?
Yeah, look, someone just echoing my thoughts as Anna was speaking there. I've totally dropped my guard on COVID. We'll be more vigilant now. Now, I used to be super vigilant. And, you know, I've been disparaging of people talking about the post-COVID thing. Of course, it's still bubbling around. But yeah, I haven't done anything about it, you know.
I've got a 14-year-old who came to me this afternoon. She had a teacher only day. Dad, I feel sick. What does it feel like? I've got a cold. Go and test. Doesn't have COVID. But I've dropped the vigilance in that I'm not masking now. And what I would be interested to know, December 2022, was I still wearing a mask to the supermarket? Because if I was, that means I should probably be doing it now. I saw a piece written by Emily Wrights talking about having COVID, et cetera, et cetera, et cetera. You know, I think one of the things people love about her writing is she talks about her life like it's an open wound. And it was one of those posts, you know, and someone in the messages said, just think of this though. I went to the supermarket yesterday and about a third of the people were wearing masks. It's like, oh, that's interesting. So some people are catching up on this and are doing something about it. Yeah, but I think I think all of us have dropped out. I mean, like, of course, since we were locked inside, everyone's down a step from that, aren't we? So everyone has on some level.
Yeah.
I think where we're at the moment is if you're feeling sick in this house, still test. But see, this government's taking those free tests away in what, 2 months? Then what?
Yeah. Also, just put the question out there: how did people hear that there's a bit of an uptick at the moment? And so here we've got. I heard from Reddit.
Oh, nice
stuff. 30 minutes before this show, I saw it on News Hub. Radio New Zealand had someone last week. Finding out just now. No, only just finding out now. Heard a couple of days ago. Heard today. So
well, I heard today as well. So yeah.
I mean, I heard maybe a couple of days ago, and a colleague of mine caught COVID last week, so that's probably sort of focused that a little bit. And yeah, look, sometimes it's like, oh, what variant and rah 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 rah. Look, the same thing applies: mask, ventilate, vaccinate, isolate. It's all the same rules. And you might not be able to do all of those things 100% of the time, but like rolling the dice on catching it, anything you can do has got to be increasing your odds. It's just being aware of it, that it's still around.
Yeah. I want to read one because I've got something to play which is not in the lineup as well. Nick saying, meanwhile, over at Karen Plunkett's channel, all right, everybody, line up, time for ivermectin pills. We laugh, but we know it's true. I want to show you something. This wasn't a part of the build-up, and I haven't told anyone it's coming. I'll show you a tweet I put out today. This is for real. The tweet reads this. The epitome of a dishonest actor is Karen Plunkett. This morning, a guest on his show said, and I can show you the tweet here, New Zealand has a special bicultural relationship with Māori. Plunkett responds, who says, Grant? How? Where's that written down? Like, that founding document thing. And it's like, if you didn't laugh, great. And I haven't queued it up because I didn't know I was going to play it, but it was somewhere in here. We'll see if we can just get it. It's just awful.
Right. This New Zealand has a special bicultural relationship with
who says?
Māori. Oh,
who says?
We do.
Who says, Grant?
Absolutely, we do.
How? Where's that written down?
Jesus.
Just that. Where's that written down? The repetition. I'm just
fucking
wondering.
To Papa, mate.
Yeah, I'm wondering if that where's that repeat is like him going, oh yeah, I know what's written down, but I'm playing this role of a dishonest actor, so I got to get the question out to my cooker audience, sort of thing. Anyway, that was a little tangent there, but see, I can do short tangents, Chewy, unlike some people. Anything else in the chat?
Let's see. Let's do this super chats. Aren't we glad Assistant Minister of Education and Assistant Minister of Health, David, dictated to parents that kids with cold symptoms should be going to school? Absolutely.
Like day one,
yeah.
Like day one of COVID, those kinds of symptoms.
Yeah, absolutely. Or measles.
Yeah.
Or any one of a number of communicable diseases that can get passed, and when you got 25, 30 people in a room. Who then go home to their families, who then go to work, then go back to school. Doesn't matter about the teachers. Oh, what? We haven't got enough staff to open the school. Yeah. Again, short-term thinking. They banged the drum about attendance, and now they've got to say, see, we're fixing attendance. They're going to create a whole bunch more other problems because they're short-term thinkers.
Yeah, we'll get to that next. I think we'll do Erica Stanford next. Is there any other super chats that we want to get to?
Gareth says a COVID surge would be very difficult for Winston to navigate, considering he's called it the anti-vax vote. Absolutely.
Yeah.
And Peter says, should we expect a statement on this from Dr. Diana Safati, Ashley Bloomfield's successor? I would imagine that depends on whether the government will let her.
All right. And thank you, Peter. Thank you, Gareth. Thank you, Wooming, for your super chats. Speaking of super chats, here's a little bit of news for your team. Let me just bring this across as well. Last week, again, we hit number 1 in the charts. If you haven't checked out, see up here, this is number one there. number one. If you haven't listened to our audio podcast yet and you want to give it a go, in fact, I apologize to podcast listeners because I uploaded the show last Thursday night and then I forgot to push send. So when I reopened my computer this morning, it was sitting there waiting for me to send. So you lucky folks will just get 2 episodes today. I apologize. So we made it to number 1 on the charts again last week. You can see we're pretty much a top 10 show most of the times, up in the kind of around the 5 mark. If you haven't checked us out, check us out on iPod, iTunes, Apple Podcast. They're all getting mixed in together. When you are in there, feel free to rate and review us. It will be great. And yeah, let's see if we can get to number 1 again. That's the audio podcast on Apple Podcasts. Also, say a huge thanks to these people: Cameron Roderick, Heidi Tidmarsh, John Aitchison, Joe Devonshire, Ali Hills, Laura Te Ahu White, and Kane Huda, who have all become patrons in the last wee while. If you want to support us and help what we do, if you think that these messages going out that aren't being said on many platforms are good to be said on this platform, then one of the ways you can get behind us and support us is to visit patreon.com/Big Hairy News. And a special thanks actually to Heidi. Special thanks to all of you, but Heidi became a senior producer. Senior producer is $100 a month. So love you all, but a little special mention to Heidi. It's lovely. Thank you for supporting us so much. Okay, shall we keep on trucking then? We'll go back to speaking of COVID, let's go back to Erica Stanford. So Erica Stanford was on Q&A in the weekend. We aren't going to cover the part where Jack Tame had to kind of find out from her about how these schools are going to be training teachers themselves now. And as I said earlier, my big concern about that is, of course, if schools are training teachers and then universities are getting these teachers for block courses. I mean, it sounds maybe good on paper, but if you include charter schools in there and you've got someone like a Destiny Church, having a charter school, then also being responsible for training the teachers, and then just, where's the quality assurance, basically, is the thing when schools start training the teachers rather than the universities doing an overall course. We're actually not talking about that today, but you could go back and watch the interview with Jack if you want to catch yourself up on it. What we are going to do is talk about, we're going to talk about what we've just been talking about. We're going to talk about COVID to start with. We're going to go into a couple of other topics as well. And even though I've played this tonight, I will play it again because it's only short. Erica Stanford asked about why she thinks teachers are on the top of the billing when it comes to catching COVID.
A 2022 Ministry of Health data found teachers have the highest self-reported cases of COVID infection of any profession. Otago University researchers found teachers are the most susceptible when it comes to professions for long COVID. Why do you think that is?
Well, because they're surrounded by sick kids, I guess. I mean, that's the...
Yeah. So all I wanted to play is that much so we can hear that they're surrounded by sick kids. The government knows that, and that prompts a new lines of question from Jack Tame, where he wants to know about the pledge that this government has made to have more kids at school for longer, as Chewy just said, even with a sniffle. Will that pledge, these are now my words, put teachers in harm's way who are already the unluckiest in the country, getting the worst amount of COVID? And the question is, will this government, see, this is where the game starts getting played. Will this government mandate this so much just to make sure their numbers look good over and above the health of the students, the families, and the teachers? That's the concern. So they talk a little bit for a few minutes about that, then they come back to this part of the conversation around, sick kids going to school.
So your attendance and workforce goals are really clear. Do you think there is a risk that in trying to avoid disruption, trying to get more kids back in schools, which I think everyone agrees is a noble goal, you will inadvertently create more disruption by having more illness?
You're talking about the new guidelines for
well, no,
illness.
you've set targets, for example, around school attendance, but at the same time, I've described to you, the pressures that are being caused by illness in schools already. And is there a tension there? Is there a risk that in prioritising school attendance and really pushing that issue, inadvertently, you're going to create a crisis whereby more teachers are sick?
Well, and also more students. That's the other thing. More teachers, more students, and that therefore means more people, because as Anna Brooks is just saying, they take it home. So, good question from Jack Tame, but he left out a part of the equation. Teachers, yes, because they're talking about teachers, but also students and those students' families. So it's a flow-on effect.
Well, I'm what would you say I should do in that? Just
what we should say you should do is if the child is sick, stay home. It's actually a really easy answer, Erica.
Super easy.
And you play kind of dumb here, like, well, what else could we possibly do? Yeah, if you're sick, stay home. Just thought I'd help you out.
She's a sick.
Well, I'm kind of, what would you say I should do? And that's what, just ask more children to stay away more often. I'm not going to do that because we know.
Yes. More children to stay away more often if they're sick. But you hear what she says straight away? I'm not going to do that. Why? Because they've said labour attendance bad, national attendance better. So therefore, they actually can't tell sick kids to stay at home, because if they do, it'll be national attendance no better than labour attendance bad, ipso facto, national attendance bad. So she says, I'm not going to do that. And it's not because it's for the health of the children, it's because it's for the policies of the National Party. Have a listen again.
And that's what, just ask more children to stay away more often. I'm not going to do that because we know that every single day they spend at school is absolutely vital to their chances of getting NCEA. We know that. And in fact, we have to get the habit of regular attendance back into families' homes, because it's so vitally important.
Yeah.
So I'm not sure what you're suggesting, but of course we want
sick children stay home. It's not that
Not even
different,
sick
Erica.
children, mate. Just like, if you're sick, don't think you have to be a fucking hero. Use your sick days. Make sure that you are setting the example, that you don't make your colleagues sick.
Yeah.
You know, this is where it comes from, is that, yeah, you've got to go. You've just got to tough it out and soldier through. Like, I remember being so ropeable that a colleague of mine came to work with the flu and took out 6 of us over the next week. And he could have just taken the time.
Can I also suggest as well, though, there's an employment issue there as well. You know, if you don't have enough sick days, it puts financial pressure on you to come to school, come to work sick. So maybe there is some legislation. This fucking government's not going to do it, but maybe there is some legislative changes that maybe there can be some kind of, as long as you get a doctor's certificate, 6 days don't really count. Those 5 days can be for whatever reason. Anything above that, you have to have a doctor's certificate, and I don't know, you get ACC, which is 80% of your wage or something like that. Because I agree with you, Chewy. I would be ropeable, and actually, from a business point of view, your bosses should have been ropeable. They should have probably sent the person home, because they made the workplace function much more poorly for probably the next 2 weeks, where however long it was.
And look, there's countries overseas and there's businesses that have unlimited sick days. And what they found is that people, they get a job and they generally want to work and make money. But, you know, you give your staff unlimited sick days, people don't really tend to take the piss.
Yeah. All right, let's keep going with Erica.
We want all of our children to be at school regularly. And yes, that may have an impact potentially on illness. And that's why we have to have more relievers. That's why we're looking at having better teacher supply. And I know it's...
Can I just say one more thing? Sorry to interrupt already. This is the second time in the last few days the government's done this. They say this is how we solve the problem. More teachers, more relievers, before they are able to solve the problem. Okay, so again, get more teachers, get more relievers, and then not worry about them being sick. But what you're saying is next week we could have a lot of sick teachers, but what we need to do over the next few years is get more teachers available. So the solution they're offering is we all want, I think, more teachers and more relievers, great, but it's not going to provide the answer for today. So I think that, you know, a half-pie, decent, honest group would first of all fix the problem of lacking numbers of teachers before they'd start throwing the other teachers into the COVID pool to make them sick with all their students who now have to come to school if they've only got a sniffle. That's what I think they need to start doing.
But the option to say, oh, well, just stay home from school more often is not an option for this government.
So your
truer words couldn't be said for this government, not for the health of the children, not for the health of the teachers, not for the health of the families, but, quote, for this government.
Efforts to increase the number of teachers and the number of people coming into the profession, like you said, is kind of a medium-term goal. Do you think, given the pressures facing teachers at the moment, do you think it's likely we are going to see more schools have to close down during the winter period, temporarily, because of illness?
Look, that already starts having to do some of those things where they're putting classes together. And the schools do an absolutely incredible job managing some of these pressures while we are sorting out teacher supply. So they get classes together, they're rostering, different year groups. They do an incredible job. Like I say, I don't have a silver bullet. I can't magic up teachers today. I've been in the job 6 months. We've got plans.
So why are they making changes that require more teachers? That's the thing. It's like going, I've got a rugby team that needs 15 people. I've only got 9 people at the moment. Well, we're going to start playing the games now with 9 people. And what happens when you get an injury and you're down to 8 people? Well, we need to get some reserves. We don't have them now, but we need to. So we're going to start playing the game now with 8 people. It's just it's lunacy. It's
I know
lunacy.
it's a really tough time for school, and we'll do everything we can to support them.
Top of the list.
There you go. That's the end of that clip, Joe. Any thoughts, sir?
Oh, not really, which is probably about as many as Erica Stanford had during that interview.
It's all pretty obvious, though, isn't it? I mean, like she said the quiet stuff out loud. This is not an option for this government. Yeah, we know. We get it. This is all about the government. This is not an option for the teachers. This is not what's best for the children or the teachers or the families. This is not an option, again, quote, for this government.
So you're trying to attract more teachers, and you're illustrating the point that you don't really give a fuck about their workplace safety.
Yeah.
The quality of life while they're in the job. Like, this is what they don't get. It's the same with the police. It's the same with the nurses. Pay and conditions, pay and conditions, pay and conditions. It's the only thing that matters. And this comes very squarely under the conditions.
Yeah.
Teachers were saying right from the get-go that their classrooms were poorly ventilated, that they didn't have the space to spread people out, and they got sick in their droves.
Yeah, 100%. 100%. Hey, let's keep going with this situation though, because we're speaking about schools, obviously Minister of Education, and they go to have a bit of a chat about charter schools, which I think is an interesting one. And the main, I'll give you the rationale as to why I think this is important at the end of the clip, probably during the clip. I can never survive to the end of the clip. But they're talking about charter schools, and they're asking the question. And look, I'll give some credit to Erica Stanford here. She doesn't beat around the bush. She just goes, look, just to negate all your future questions, yes, that's right for all of them, which is she didn't get as hard a kind of grilling as many do. And I think for the most, she was answering the questions. Some of the questions were pretty awful, but she was answering the questions. And I think you see with Jack Tame, if you answer the question, even if it's a horrible answer, he tends to move on, which is appropriate. So talking about charter schools and asking charter schools, if they will be subject to the same conditions, the same demands that the government's putting on public schools. That's sort of the start of the conversation.
So to be
And
totally
if you're
clear,
that family living next to it, well then...
To be totally clear, hour of reading, writing, maths a day, will that apply to charter schools?
Sorry?
That rule? The hour of reading, writing and maths a day?
We can go into all of the things that you're about to say to me, and none of them do.
So that doesn't, cell phones don't,
no, because
structured literacy doesn't.
What we expect is for them to innovate and be ahead of the curve. I expect, actually, they will look at all the same research and evidence that I've been looking at, because they have to get results, right?
Sure.
So they'll look at all the same research and evidence that I'm looking at and go, actually, yep, that looks good.
And you're saying if they don't...
It is a concern that they think so highly of these charter schools. Charter schools, I'm assuming, Chewy, people will start up as a business investment and to make money as well as hopefully think they can do better schooling. But to kind of sit there and go, they're going to do all the right research and apply all the best standards. Just like, what's your evidence of that? Like, honestly, why do you think that these groups, these charter schools, which failed the last time around, are all of a sudden going to be ahead of the curve of sort of the education system of hundreds of years and, tons of professionals and professors from around New Zealand? I don't quite understand. It seems that this government, maybe any government, this government's fairly able to trust you wholeheartedly if you fulfill their narrative, even if you fall short. And if you don't fulfill their narrative, they have no trust in you whatsoever, even if you live up to what you should be doing. It seems, you know what I'm saying?
They are literally going to piss money up the wall on this failed experiment again.
Yeah.
It's, look, we've spoken about this before. There might be a place for charter schools. I don't think there is in the numbers that they are talking about. I think it was Seymour that was saying that they might just convert state schools into charter schools, and the schools themselves have no say in it at all. It doesn't sound good. It doesn't sound well reasoned. It doesn't sound well researched. But this whole thing of going, oh yeah, state schools have all of these rules and charter schools have none of them because they're innovative, I think is incredibly naive.
So this is my big point that I was going to try and save till the end, but I'm going to blow it early. If this government is standing up the front of the podium saying, we have the best way to get the best results from these students, it's an hour of reading, writing, arithmetic. It's no cell phones in schools. It's the new way of doing literacy. This is the best way for children to succeed. Oh, all you charter schools, you don't have to do that. Now, that either means that what they're asking of public schools is not the best way, or they're basically saying charter schools, you can be a level down because the way public schools are doing it is the best way. The way we're going to force them to do it is the best way. Now, if that's the best way, why aren't the charter schools going to do it? Unless it's not the best way, Chewy, and they know it. All right, I'll keep going.
Meet those standards.
That you're about to say to me, and none of them do.
So that doesn't, cell phones don't.
No, because
structured literacy doesn't.
What we expect is for them to innovate and be ahead of the curve. I expect actually they will look at all the same research and evidence that I've been looking at, because they have to get results, right?
Sure.
So they'll look at all the same research and evidence that I'm looking at and go, actually, yep, that looks good.
And you're saying if they don't meet those standards, then they'll lose the contract.
But they might actually go further. You might actually find that there are a number of charter
skip past that question, didn't you?
schools who ban smartwatches and other devices because they're looking at research and going, actually, we want better results. What can we do to innovate? You might find that they go, actually, structured literacy is amazing. We now want to bring in structured mathematics or math mastery, and we're going to do the same in science and other subjects and actually be ahead of the state system because they have to get results, because if they don't...
Oh, I think I've got one of these, haven't I? Isn't one of these that? Oh, hang on, that's that one, isn't it?
The label your button.
It's not that one. That one. Sorry, I was just looking for the fairy dust to put across because, this is what she's doing. Because they might do that. Oh, they might be better. That's what it is. It's no more vibes. It's now, it might be better. It might be better. They might just look at that and they might be better. They might look at structured literacy and they go, that's the best way. Then why aren't they being forced to do it like all the public schools are? Unless they're going to find a better way. And if they find a better way, then your way is not the best way. And why are you forcing state schools to do it? Maybe.
Don't, then there are consequences.
So the cabinet paper on charter schools promises improved learning outcomes for Māori and Pacifica. You talked about the evidence you've considered there. What evidence exists from the previous iteration of charter schools that it achieves those learning outcomes for those groups?
Well, when I take a look at the local one in my electorate, Vanguard, they are taking kids who fail in the mainstream from all over Auckland, in fact, outside of Auckland.
We can't let this go past. Always these ministers go to an anecdotal example. So because this one that I've seen locally is doing it well, then all of them are going to be great.
And I go and talk to those kids every year. I sit down with their new recruits, and you hear these heartbreaking tales of the fact that they were never succeeding in the mainstream. They thought that
this is the thing. This is the saying quite out loud. What you're doing is you're going to force a whole new generation, Chewy will tell you, to not succeed in the public sector by doing this 1950s style teaching. However, 15 charter schools are going to start off with, and there's going to be a cost to them. So all those kids who can't afford or don't have access to a charter school are now going to fall through the cracks. They're going to be these kids you're fucking talking about that haven't succeeded in the system. You're creating a generation of that, and you're doing that to say, but charter schools. So 15 of them. Okay. What happens if the parents can't afford it, or there's not one in their area that this kid's going to fall through the cracks? It'll just work.
No.
And you hear these heartbreaking tales of the fact that they were never succeeding in the mainstream. They thought that they were never going to succeed. In fact, many of them say to me, we thought we were dumb. They get to a school like this that has the flexibility to innovate, the flexibility to do things differently. And these kids are now...
It sounds like she's saying that's better. So why the fuck aren't you doing that at every school? Like, she sounds like she's saying that's better. Doesn't it sound like she's saying charter schools are better? The way charter schools are going to do it is better. So then why are you forcing public schools to not do it that way? I kind of feel like you want to jump in here too. You're welcome.
Because it's their standard narrative, Ben. Government, large, unwieldy, slow, even when we're in charge of it. State schools, large, unwieldy, slow, bound by rules, all of this sort of stuff. Charter schools, sexy, innovative, agile, private, money making. You know, just remember, whenever they are bigging up these charter schools, it costs around 10 to 12 grand per year to teach a student in a state school. Last time they tried this charter school bullshit,
48.
50 grand per student. Like Vanguard's the school that she's talking about is Vanguard Academy, which is a military style academy school. And they always trot this one out because it has that image and it has a lot of success stories and that sort of thing. And they're using that as like every charter school is going to be like this. But it's not. All the other charter schools will be some sort of wackadoo religious, don't have to follow the state prospectus bullshit at all, and they can teach whatever they want. They can have anyone teach it. You don't have to be a teacher.
Yeah.
There's no state oversight at all on educational outcomes in these charter schools. For every good one you have, you might have 3 or 4 that are shithouse, that are just churning out the next generation of bigots and nutbars.
And let me say this, a good education system, one that we can actually be proud of, which is sort of the words that they're talking about, greatest little country in the world, best education system in the world, would be a system that those kids wouldn't fall through. She's just talking about kids who felt like they were dumb. A good education system would work where they didn't feel like that. That an education system would be able to like provide for all of their kids, not back to the 1950s of reading, writing, and arithmetic, which is going to be perfectly fine for a lot of the kids, maybe most of the kids, the academic kids. I would have been okay with that. My brain works in a certain way, even though I'm dyslexic. I like numbers. I like shapes. It works, right? For other people, maybe not so much. And a good education system would have a place for them and a way to teach them and not just go, hey, there's charter schools for you. There's not one within 200 Ks. Maybe that's how you can get there every day.
I'm not even going to say that all charter schools are bad. I just think the space that they operate in would be extremely limited.
Mm-hmm.
And I think that they should receive no more funding per student than a state school does.
Sure.
You know, because I'm sure if you flooded the state education system with 50 grand per student per year,
Yeah.
they could fucking pull some pretty good results out there as well, because they're able to pay their teachers more. They have more resources. You know, they're able to hire more relievers or assistants. They could bring their class sizes down. All the things that charter schools do, if it's going to come down to just a question of funding rather than these guys look like they're an American-style military academy, isn't that cool? State schools can get those results as well. You know, state teachers can be just as effective when they're not under
and
the
innovative,
pump, fighting off.
Innovative.
Give them. People are innovative when they're well resourced and they have time to think.
Yep.
You know, and so that's what it comes down to.
Yeah. All right. Hey, listen,
this state system the money it needs.
100%. This has got about 2 minutes to go in my notes, so let's just get to the end of it, and I'll try not to interrupt, and then we'll move on to the last story.
100% of them get NCEA. They get all of their kids across the line.
This is anecdotal, right? And this is an independent school
Jack.
that currently exists under the current model, but under the previous iteration of what were then called charter schools, is there high level evidence that suggests that learning outcomes for Māori and Pacifica were improved?
Look, you're going to have to talk to David Seymour about the detail on all this, but I know.
Oh, this is the I'm running away now. This is the equivalent of run away. You know that scene from Monty Python, Holy Grail, run away. Run away. That's what she's the fucking minister. She's the buck stopper. This is the runaway bit.
Were improved.
Look, you're going to have to talk to David Seymour about the detail on all of this, but
The-
I know
the regulatory
overall,
impact
You're the
statement says
minister.
it was
Overall-
the regulatory impact statement says it was unclear if the model had an impact on the academic achievement of these specific learner groups. That's what the regulatory impact statement said. But then your cabinet paper said it promised improved learning outcomes.
yes, well, it wasn't my cabinet paper, it was David Seymour, so let's be clear
Well,
about that.
you're the minister with overall
away!
responsibility.
Run away.
He's in the detail on this. I am the
But see what I mean? The cabinet paper's promising one thing. The regulatory impact statement from when
said it wasn't
charter
clear,
schools are
right.
said there was no evidence.
But we're doing things differently this time for a start. So David Seymour is taking a look at what
Not necessarily better, as Joy always says.
we did before. This is a small scale trial where we're not going to set and forget. We're going to learn from as we
It's
go.
not that small.
Well, there's 15 new schools, right? So in the grand scheme of things, quite small.
Relative to the overall.
Quite small, right? So we're learning from what happened before, and I know David's doing a number of things differently. But secondly, it's all about the contracting, right? So when we're saying to it, the whole point of these new schools is to set up to offer those people who don't have any other choice but their local failing school something different. And the contracting is the really
Even the framing of that, their local failing school. Remember, we had this conversation with a person, I didn't say who it was, from a department last week, and they said to us in our meetup, we're contractually obliged to not criticize the public department we're living for. And she just goes out there and basically just whitewashes, the failing local, the failing. That's the framing of it is that the local school will fail and the charter school will be fantastic. I do like that sound effect. It's working. It's worth its weight in gold today.
important part. You have to meet certain outcomes if you want this funding and if you want to be a charter school. Because currently, the alternative is, we're sending our Māori and Pacifica students to schools that fail them and have failed them for decades. We want to try something different. We want these schools to innovate.
Got it. So Māori and Pacifica are an experiment. That's what you're saying. Because what you're saying here, okay, let's be clear. What you're saying here is it hasn't worked in the past, so we're going to give something else a crack. So what you're doing is you're going to get a generation of Māori and Pacific children and children in general, and you're going to do an experiment on them. And it might work, but guess what else? Might fucking not.
Fail them and have failed them for decades. We want to try something different. We want these schools to innovate. We've seen the examples of where it's worked incredibly well. We want to take the example of Vanguard.
Yep, this has got about 12 seconds, but yep.
Yeah. So the implication, well, not even the implications, you just spelled it out. Māori and Pacific Islander students are not served by state schools. They get poor results, so it's not working. So we've got to head the charter schools. And the example of the charter school that they're holding up is a military academy. It's not, we've listened to people in the Māori and Pacific Island communities about what they think their students might need, different forms of learning and that sort of thing. We haven't got an example like that. We've got a military academy.
Yep, too true.
Examples of where it's worked incredibly well. We want to take the...
She also does say examples. So far, she said example, singular, not
just Vanguard.
Example of Vanguard.
Yeah.
How do we get that across the whole country?
You are mandating structured literacy and scrapping funding for reading recovery.
That's it. That's what we've got up to.
What? No. Hang on. What was that last bit? They're scrapping funding for reading recovery.
She goes into quite a long-winded conversation around the new system and how it's going to work and how it's better. I can play it if you want me to. It wasn't part of my notes. Do you want me to play it?
No. We won't go off book. I'm going to read into that. Pun intended.
21 minutes and 9 seconds into the interview, if you'd like to pick up on it yourself.
Cool. Look, that's a button issue for me. As I mentioned on the show a few days ago, I'm a product of the Reading Recovery Program.
Yeah.
And if they could get an ADD kid to read before they even really understood what the fuck ADD was, then that's a good program. I love reading. I devoured books in my preteen years and in my teenage years and that sort of thing. And then it comes down to that program. And they want to say that reading, writing, and maths is really important, and then they want to cut funding for reading recovery?
Go and do some research on it, because they are cutting it, but they're not cutting funding for helping people who, this is what they're saying, people who are reading below their age. So they're replacing it with something else that they say is better. We can't do everything. That's why I didn't have it on the list.
I'll look into it.
You go look into it. 21 minutes and 9 seconds. And if you want to do it again, bring it back tomorrow night. Bring the clip and we'll go again. All right. Is there anything we need to get to in the chat in particular? Oh, there seems like there's several super chats in there.
Yeah. Talk to David Seymour, but he's the worst example of learning from the past.
Thank you, Gold, for the super chat.
Charter schools, innovative invoicing. Yes.
Cheers up. Thank you.
Good. Attended a conference in the US with about 8,000 teaching professionals. They all said it's a complete failure with the charter school model. Yes, and right-wing governments over there went hard on charter schools.
Yeah,
that was that was a salve to the religious nutters and the libertarians over there that weren't happy with the idea of state schooling. And yeah, they have pretty much a generation of subpar learners coming out of there. And I'm sure, I haven't looked at it, but I am sure if we looked at the UK, this idea has been floated around before as well, because national love copying the homework of the Tories. Yeah. I think Erica Stanford's actually just come back from the UK.
Been over there somewhere. There's another Pickles I care in there as well. Thank you for your super chat. Those who they think will fail are not allowed to sit exams. Happens in charter schools, so pass rates are high. I've actually heard that as well. So they actually curtail their exam sitters, and then they end up getting a better pass rate. And I think there's one more super chat, isn't there, with Peter? Do you want to grab it or shall I?
Yeah, I got it. I've been on hiring panels. Probably wouldn't shortlist charter school graduates. Definitely not Destiny. Yes, absolutely.
There you go. Yeah, so what would that look like?
Not a super chat, but quite a good comment here. Research and evidence trotted out by Seymour is rubbish. The Stanford report he quotes is non-peer reviewed and published by a right-wing think tank funded by the Walton family.
All right, fair enough.
Oh, that's not surprising, is it?
Okay, let's get on with this last story. And now we are going to be doing, I would imagine every night this week, something on the budget, the upcoming budget. As I said, we've got Dave Rennie joining us at 9 o'clock on Thursday. He'll be fresh off doing a bunch of media things, and he's going to come on with us live. We're also looking for some political leaders to come on this week. I've contacted them all. We'll see what happens. But I thought it's nice to have an actual economist who will be over it like nothing else on Thursday night. And he's a great dude, and he'll probably be with us for the whole evening. I'm hoping, at least, anyway. If he wants to, if we need him to, if he wants to be, but for a good portion until the conversation's done. All right, let's get back to this last story, and it is a story based around the budget. It's a little bit of the preeminent what's coming next. What's happening right now, and we said this to you last week, we said to you for the last month, is they're setting up the country for delivering less than they promised pre-election. Whether it's average tax cuts for people or whatever, as we speak right now, the tax cut calculator is off the National Party website, and they're going to put a new one up, which means I hope everyone did their tax cuts who's going to get them, and you took like a screenshot so you know what it's going to be, and you can compare that to what the tax cut's going to be on Thursday. What they get, because my suggestion, Joey, my thoughts are they're going to be a fair bit lower. They're going to be a fair bit lower, Sunny Mijin. So we'll get to see that. But yeah, they're basically setting up the country, I think, at the moment for don't expect too much. Can we expect at least as much as you promised? You just don't expect too much. That's the sum of the conversation at the moment.
Christopher Luxon and Nicola Willis know it's a big week. Cutting a confident duo, they say they're ready.
Big day Thursday, budget day.
To mark the occasion, a slick PR video.
This budget, our budget, is all about you.
Nicola Willis saying while she can't fix all the country's problems in one...
I get the sense, though, that's what they were promising before the election, that would fix all the economic problems. No, they might not have said that, but I thought that was pretty clear through their positioning up until the election, that these guys bad, we'll sort it all out. Not like we'll fix some things, but we can't do everything. That didn't seem to be the vibe before the election, at least.
And budget, she can help with household costs.
We will deliver tax relief.
Māori, meanwhile, are mobilising. calling for a National Activation Day on Thursday, a move that threatens scenes of discord similar to those which greeted the new government last year.
Well, look, I mean, Te Pāti Māori and their supporters are completely within their rights to protest as long as it's done peacefully, legally, appropriately, respectfully.
Right the way across the country, we're seeing increasing numbers of New Zealand.
It's funny about how everything has to be respectful when people are considering what they're doing to the country to be pretty disrespectful. This is like what old Seymour said last week about the debate. Like what he's doing with the debate around the treaty is the most disrespectful thing. He's tearing the heart. You heard Moana last week, Moana Tūwhare, talking about how Māori are taking that thing and how offensive it is. And he's sitting up at the front going, you know that really offensive thing we're doing to try and pull the heart out of this people group? As long as we can be respectful about it, then anything's okay. It's ridiculous, Joey.
Yeah, I find it, really interesting that, of course they're allowed to protest. Of course they are. As long as they do this and this and this and this and this rule, and it mustn't hurt my feelings. No, they don't have to do with that. Arguably, you have to say that they have to be legal.
Yeah.
But outside of that, no.
Yeah.
Get fucked.
And even the legal thing, civil disobedience to some level. I mean, burning a building down, no. Blocking a roadway and being technically in breach of the law and holding up a few cars for a wee while, yeah, not so much. So there are layers there as well.
There is already tone policing going on about Te Pāti Māori's messaging, and I'll get to that after that before we go.
All right, I'm just watching the background sign reader. She looks like she's dancing, eh? She's having a good old jam at this, having a good time.
Legally, appropriately, respectfully.
Right the way across the country, we're seeing increasing numbers of New Zealanders concerned about the actions of this government.
Nationals tax cuts are stated clearly in the government's coalition agreement. For an average income household, think two parents with a combined income of just over $126,000.
This is a beautiful question by Mikey. It is beautiful what she asks Nicola Willis. I'm just savouring it before it comes. I'm keeping you all on tender hooks.
They'll get tax relief of up to $100 per fortnight. That's $50 per week or $25 per adult.
Will you commit to still funding that $100 a fortnight for the average household income?
I'll commit to sharing our tax policy with you on budget day. It's just 3 sleeps away. And what's more, we will have a tax calculator available on the Treasury website so every household can look at the tax relief that's owed to them.
Nationals' own tax calculator from the election campaign today nowhere to be seen, with hints Thursday's tax package may be less than originally promised.
Hints. And yeah, forgive me, I think I said Dave Rennie, didn't I? Because I was thinking rugby. Craig Rennie is joining us on Thursday.
Well, clearly the numbers that are going to be up there on Thursday are different to the numbers that they were promising up until now.
I wouldn't read that into it. It's just simply that there's going to be an official tax calculator from Thursday.
A recent survey.
So if you wouldn't read that into it, that means they are going to be the same or better? They are going to be the same or better.
Please don't read ahead.
Because if they're not going to be the same or better, then what we're reading into it is accurate. So so what you're saying is if we don't read that into it, then they're going to be better. Good. Okay. So Nicola Willis confirms that the tax cut's going to be the same or better because we shouldn't be reading into it less. So perfect. Thank you. We all know.
Survey by the Auckland Business Chamber shows 65% of businesses have negative business confidence, up a whopping 13 points from last quarter, while 55% are making less money compared to last year, up 5.
That's weird because who was in this time last year? I'm just trying to think who was running the country this time last year. Those guys that were really terrible and did everything wrong with the economy. Who were they? Something like Libor? Is it Libor? Something like that?
Now, I'm going to say, in fairness, the same thing that I said last year when Business Confidence Survey got toted out. The Business Confidence Survey is the biggest load of horse shit that ever gets used. Like, it's just ridiculous. How do businesses feel? I don't care. Give me stats. Like 55% decrease in revenue. Absolutely. That would account for their lack of business confidence, wouldn't it? Business confidence is just vibes captured by a major bank. Fuck that measure. Like it's given so much weight and it's based on thin air.
But we do know. These
guys.
We do know if National if Labor within the last year and had these kinds of numbers, National would be using it in their advertising and from every billboard. So fair's fair, all's fair in love and war, comparable. But yes, you're right. 55% of businesses have seen a decrease in revenue today versus 12 months ago. But that's probably an anomaly because those guys 12 months ago didn't know what they were doing, according to Mr. Luxon.
5 points on last quarter.
But I do think there'll be some hope from businesses, particularly at the smaller end, that there'll be a bit of sizzle with this pretty lean sausage, if I can put it that way. That,
Please don't.
Maybe there's be some policy reforms. Maybe there'll be a sense of regulation busting.
Whether it's sizzle or a fizzle, we'll find out in 3 more sleeps.
God, can we please get away from alliteration and rhyming in our news, for God's sake?
And 3 more sleeps, to be honest. 3 more sleeps is what you say to kids about Christmas. This isn't Christmas.
Well,
Like,
it
this
is for political. It is for political reporters, I'm sure.
Oh, it is. But for the rest of us, we rush to Nicola Willis's Christmas tree, open it up, and find out what shape and color of turd we're getting.
Yeah,
like the tax calculator thing is so cynical, and we all know what's going to happen. We're going to compare those numbers. People write the numbers down. People have memories.
Yeah,
we're going to fucking do it live to air. I guarantee it. Like it's just so dumb, so dumb. And if you voted for National for a tax cut, I want to hear from you. I want to hear how happy you are. Has it worked out well? Have your costs gone up? Fucking hell.
Now listen, we're kind of getting towards the end. There's a story that I hadn't prepped at all tonight, but it does relate to the budget. This was an exclusive to News Hub. That's why it wasn't preempted, because we didn't know about it till after 6 o'clock. Literally life and death cancer patient, because we talked about this last week, begs government to keep cancer drug funding possible. It's 5 minutes. I don't think we've got time to watch the whole thing. Do you want to watch the first 60 seconds of this, or should we come back to it tomorrow?
No, give us a taste.
Okay, we'll have a taste, and maybe we'll come back to it tomorrow anyway. So this is budget related. Then after this, we'll shoot off for the night. Here we go.
News Hub can reveal more than 200,000 people are in need of drugs sitting on Pharmac's wait list. Medicines the drug buying agency said it would fund if it had the money.
And now all eyes are on this week's budget to see if National will keep its promise to fund more cancer drugs. Political editor Jenna Lynch has this exclusive report.
Lydia Pay-Pereira and Vicky Hudson-Craig, both hardworking, loving mums, both in their 40s, and both have cancer.
I've got stage 4 melanoma, which has spread to my heart.
They found a mango-sized lump in my stomach.
They also both rely on drugs not funded by the government.
When they said it wasn't funded, I think it was just terrified. I just remember, we just all cried. There was 3 of us in the room. We just cried.
Oh, look, I'm always pissed off, always. It's not something that you want to hear.
Both of the treatments they're taking are on Pharmac's options for investment list, basically a wish list of drugs it would fund if it had the budget, but it doesn't. So they each need to rely on fundraising $5,000 to $6,000 a month.
You know, hard enough just to buy bread and milk for some families, and asking somebody to come up with $6,000 on top of everything else that's going on for them, just living in general.
Having cancer, on its own, that's enough to battle, but then to be constantly worrying about how you find that level of money just to stay alive is just, it's impossible. Right?
In December 2022, the number of patients expected to benefit from treatments on Pharmac's waitlist was 172,000. By March this year, that had grown by more than 50,000 to 228,000, a 32.6% increase.
We're the only country in the world that has a waiting list for medicines, and some of those medicines have been sitting there for 15 years or more.
I'm living proof that this drug can work. So why wouldn't you want that for me? Why doesn't the government want that for me?
National pledged on the election campaign to fund 13 cancer drugs. Lydia's wasn't on the list, but Vicky's was. She needs them to keep their promise.
Will that be funded in this year's budget? Because there are people right now that are relying on those drugs that are looking to you for help.
I'm not making an announcement about that today. What you have seen is that we had to find $1 billion more than anticipated.
for fucking tax cuts. Sorry, I know everyone's thinking it. I just wanted to say it. We're to find $1 billion more because we're giving $3 billion back to fucking landlords.
What you have seen is that we had to find $1 billion more than anticipated simply to keep the Farm Act budget going.
You know, our lives are dependent on it, and that promise was a lifeline.
She wants to be here to see her little girl Ruby grow up.
Oh.
I can't imagine having grown up without my mum, and I don't want that for her. It's as simple as that, really.
To her, this year's budget isn't just tax cuts versus spending cuts.
It's literally life and death.
It cannot get more serious than that.
Oh, a horrible story. Oh, and look, there are always going to be governments that don't have every single drug needed on Farm Act, but I am not ever going to give this government a break of we can't afford it with that $3 billion amount. Forget what it is. Tax cut, reimbursement, depreciation, whatever. It's the reality. It's $3 billion out of the coffers to landlords. However they cut it out, whether they use a fork or a knife or a spoon and call it whatever they want, the sum total is it's $3 billion out of the coffers back to landlords. So if anyone ever says to me in an interview because we can't afford it, oh, I tell you what, that's going to be fireworks, Chewy, fireworks.
No, you can afford it. There are things that are worth spending the money on: feeding children, making sure they're educated, making sure that our healthcare system stands up, making sure that people have a place to live, making sure that people that have horrible forms of cancer that we can stop get the medicine that they need. And you go, all of those things are important. All of those things cost money. How do we get there? And sometimes the answer is landlords don't get tax cuts. Sometimes the answer is we know that New Zealand's wealthiest people don't pay their fair share. We know it. There is the money. Go get it.
And just remember, to their credit, as evil as it makes them sound, Chris Bishop was talking last week about this government has to make choices. Yes, you do. And you're picking landlords over people dying from cancer, over the vulnerable, over solo mums trying to buy their first house. That's national. That should be the headline. National 2026. Landlords over cancer sufferers. Landlords over first home buyers who are single mums. You know, landlords over the vulnerable. That's who you have elected, people who voted for them. A vindictive, evil, nasty government who think they might be doing the right thing so you can get $8 a week back in tax, or if you're a landlord you can get more money back than you've been getting at the moment, and if you're not getting that now, then obviously your investment works without getting it. Landlords aren't selling up 6 months ago, 12 months ago. They weren't selling up going, we can't afford this. So you can afford it, landlords. So this is giving you more, because if you couldn't afford it you wouldn't be a landlord. This is giving you more while it's taking away from people who have less, and on some level, as awful as it sounds, who are less, the vulnerable.
Right. I have two things to leave on, because we're going to leave. We sort of hinted at this. Te Pāti Māori have laid out their plans for Thursday. I'm just going to scroll through what they've put up on their page. Demonstrating a unified Aotearoa in response to the government's assault on tangata whenua and Te Tiriti o Waitangi. Demonstrating the might of tangata whenua and tangata Tiriti working together. Now, this is what we've been talking about, isn't it, Pat?
Yep.
We've been talking about how Māori can't do this by themselves, or shouldn't have to do this by themselves.
Well, no. Stop. Let's be clear. Professor Margaret Mutu said can't. She said can't. That's why the buffer thing's out.
Yep. And look, everybody wants to play race baiting games and draw a line between us. This is an opportunity for people to stand up and to say that there is no line. The revolution of Gen T, I like this, right? And Generation Tiriti, the guys that have a greater understanding of the treaty than ever before, standing up for and protecting the rights of all of our mokopuna, asserting the mana of Te Tiriti o Waitangi as an enduring and everlasting document. So we're asking for all Māori and tangata Tiriti to go on strike for the day to prove the might of our economy by disconnecting entirely from it. We're asking for all Māori and Tangata Tiriti to attend your nearest rally or hikoi in your region. Hikoi in your region. Check out Te Pāti Māori's page for more info. And, you know, Luxon didn't have to say it. Te Pāti Māori's already said it. Peaceful, respectful, mokopuna focused, mokopuna friendly. Wairu apai. So he didn't have to say that. He wanted to say it because of what it implies, is that they will be a rebel and it'll be unlawful. He wanted to drop all of those hints in there for people. So that's a serious thing that I wanted to leave. And then I'm going to share something that someone sent me yesterday, and I've only just seen it tonight. Let's embiggen that. It features Shane Jones.
And if there is a mineral, if there is a mining opportunity, and it's impeded by a blind frog, goodbye, Freddie.
It's very funny.
So that should be the standard, that all of these ministers should be lip synced into a cartoon.
Very good.
That's
all right, team.
I'm
Thank you for joining us tonight. It has been, it's always hard because I love doing this and I love talking to you guys and I love being here, but some of the stuff we talk about is just shithouse, eh? It's not fair. It's not appropriate. It's not right. But we'll be back tomorrow night. Obviously, there's going to be things around the budget all week. And remember, Craig Rennie live on Thursday night at 9 p.m. And I expect we'll have some of the other leaders coming on as well. We've spoken to them all, but the reality is it'll be Te Pāti Māori, it'll be Labour, it'll be the Greens, it'll come back to us because the other guys are scared of us. They won't come near us with a 40-foot barge pole. No matter how much you cry about only having one perspective on people who don't like it, well, we ask them and they say no. So you go talk to your people and have them talk to our people. So thank you, team. We've appreciated you being with us tonight, and we will catch you again tomorrow night for another edition of Big Hairy News.
And you pick up the news, Big Hairy style, keeping it loose. New Zealand, where the politics play, they bring the truth every single day, talking about the mess all over the land. They shine a light with a mic in their hand. No time for cheese, just facts straight up. Plan chewing, never backing up. From the Cape to Bluff, no place too far. They expose the truth and raise the bar. Politicians tremble at their mighty voice. Pat and chew, they'll make the right choice.
All right, guys, that's us for tonight. Thanks so much for being with us. Thanks for being on board. A big shout out at the moment to Fuggle Nugget and Detective Boy, who also signed up to be patrons. You'll be on the credits as of next week. If you want to be a part of what we do, become part of the credits, then patreon.com/Big Hairy News. Anything else, Chewy?
No, nothing from me, mate.
All right, team. Thanks so much for being with us. See you tomorrow night from 9 p.m. All the best. Hooroo!
Cheers, man.